All right, guys. I hope everybody had a great Thanksgiving and is ready to rock and roll for this upcoming week. So we're going to start with chapter 31, which was our urinary elimination and care. Some key terms, which are all our key terms you should be familiar with, but some of the things I want to highlight to know through our chapter, in case I know some people were sick and we did have a pretty rough week last week. All right. Why is it important to track urinary output, or I's and O's as we call it in nursing? All right. And why is it important that we document it? All right. What's another word for urinate? We always call it void. All right. There's 3 waste products, and those are urea, uric acid, and creatinine. And so you need to know those 3 definitions, all right, because those are important. And you'll also notice we check those in our labs when we check urinalysis. All right, what is important about the color and clarity of urine? Remember, if it's cloudy or foul smelling, we could have a UTI going on or an infection. What is hematuria, which is microscopic blood in the urine? All right. What about pH? What's the importance about pH of the urine? What is the normal pH of urine? Remember, it's 4.5 to 8.0. All right. So one of the interventions that we always talked about for UTIs was cranberry juice. And what is the reason for that? So, of course, cranberries will cause the pH to be lower or more acidic, thus killing off some bacteria. So that's why cranberries is an intervention, or cranberry juice. Remember, it's got to be pure cranberry juice, not like the 10% cranberry juice and whatever. So remember that. Those 3 terms: anuria, no urine output; polyuria, greater than 3,000 milliliters per day. That's that number, okay? And then oliguria, which could be saying wrong, is less than 30 mils per hour. Remember that 30 mils per hour is our gold standard, or what we look for. All right, so a couple other things. Edema. Okay, so what is edema? Which we've learned previously. What medications are given to these patients that will help get rid of that fluid? Lasix or spironolactone. And what's the other word for Lasix? I can never say that word. Furosemide. Okay. What are some of the things we need to look out for with that medication? All right. Dehydration and urinary output. What do we expect to see when somebody is dehydrated in relation to their urinary output? All right. And if we're dehydrated, or how do we prevent dehydration? We want to, how much water should we have per day? Remember, I said it always varies, but minimum 8 ounces of water per day. Okay. All right. Dysuria, painful urination. And what was specific gravity? And we went over pH, so need to know that pH and specific gravity. Remember, it's the weight of the substance with the weight of equal amount of water. And normal for urine is 1.005 to 1.03. All right, so that's the normal specific gravity. So when specific gravity is low, then your urine output is more dilute. And if it's high, it's more concentrated or heavy. So however you want to look at it. Need to know table 31.1, be familiar with your urinalysis results, especially pH, specific gravity, ketones, glucose. Okay, we went over color already. Which nursing diagnosis would we give to somebody for urinary problems or having edema on them? So think of what we got going on and think of your nursing diagnosis related to the urinary system. Renal calculi, you guys remember we talked about it as a kidney stone, okay? They can occur anywhere in the urinary system. So don't think when we think of kidney stone, they could just be in the kidney. That's just where they are. But they can be in the tubes. They could be in, and people will pass them. And you would have to strain the urine. Think of what is the purpose of straining the urine? What's urinary retention? All right. And what's hydronephrosis? Hydronephrosis. All right. And what would cause that? Residual urine. We talked about that where we don't always empty our bladder fully, right? So if we have somebody with or self-caths, you want to bladder scan them, correct? Before you just do a catheterization, right? What position should they be in when you bladder scan them? Same thing, what position, if you're going to put a Foley in, should they be in? All right, when we are doing our Foleys, what positions, what supplies do you need to make sure you have? Someone's doing a self-cath at home, and they just put clean gloves on, should we stop them or correct them? Should they wash their hands first and then put clean gloves on? Okay, we talked about our incontinence. Okay, we have our stress incontinence, urge incontinence, and then the combination. And then we also talked about the obstruction. So for men, an enlarged prostate. So what interventions do we do for people with incontinence? Okay, how do we help them? "24-hour urines." What is the purpose of a 24-hour urine? I know we went into some detail in class of talking about the 24-hour urines and some being on ice and some being on out, but what is the purpose of it, whether it's on ice or not? The whole purpose of that 24-hour urine is for it to check the kidney function, right? They want to see what's happening in a 24-hour period of all the urine that's collected. And remember the procedures for that, right? So when the 24-hour urine is started, you want the patient to void first and discard that. So that's why you know you're starting with fresh or an empty bladder. If we had a Foley and we needed to get a sterile specimen. How would we do that? Do we pull the Foley out? No, we do not pull the Foley out. So there are ports on the Foleys, okay? And you're gonna take from the collection port, okay? And that's how you get a sterile specimen from a Foley. All right. What is the, again, going back a little bit, going through my notes, maturation reflex. That is a key term that you need to know. So the reflex is a contraction from your bladder that tells you you need to void. So yes, it is a muscle contraction of our bladder. Remember, Foley catheters, sterile technique. Okay. Important that we clean them. Urinary diversions. All right. Why do we have a urinary diversion? Why would somebody have a urinary diversion? Okay. What's the purpose of it? Okay, what is a continent urostomy? We spoke about that in class. All right, remember that's the pouch that is created from the intestines and the urethras empty into the pouch. So be familiar with the different types of urinary diversions and the reasons why. All right, and with somebody with a urinary diversion, what do you think is a couple of key concerns that we need to look out for or watch or monitor as the nurse? All right, so we have somebody who is on Lasix. Okay, is Lasix, what is it, potassium sparing or is it potassium depleting? You need to look that one up, okay? And then what food should we be encouraging or teaching our patients to eat with that taking Lasix, okay? Do we want bananas and oranges, or are those a couple of good foods we want to give them or encourage them to eat? Signs and symptoms of a urinary tract infection, what are they? And what are our interventions for prevention? Okay, what can we do? Okay, remember, so empty the bladder frequently. Okay, drink the cranberry juice, no tight jeans, no thongs. Okay, how about birth control? So do you think diaphragm could possibly cause UTIs? So maybe if a woman is having frequent UTIs, we need to see what their birth control is, what it consists of. Okay. Avoid baths. All right, those are a couple of things. Remember so you have your urinary tract infection, but what was cystitis and polynephritis? What are the differences? Okay, so where is the infection at? Again, no hour. All right. Okay, so a couple of big key things is edema. Okay, what medications would you expect the patient to have and what you should be doing? Okay, what are you going to monitor? All right, I's and O's. Who do you think, if you had a couple of patients, if you're going to see a critical thinking needs to kick in, you have 4 patients you're going to go see, they're all on I's and O's, who do you think would need more assistance? Somebody, not assistance, sorry, that's not the right word. So you have 4 patients and they're all on I's and O's, intake and output. So who would require more help with documenting the I's and O's? Somebody on IV fluids or somebody who's like vomiting and taking in ice chips? Do you think you'd have to be a little more detailed on how much ice they're taking in and how much they're vomiting, stuff like that? Whereas the person on IV fluids, right, you're looking, they get in 50 an hour, you know how much they're getting. So that's a little easier. So when you're looking at your patients who's on I's and O's, intake and output, okay, they go hand in hand. You need to know how much somebody's taking in and compare it to how much they're putting out. All right, so there's your checks and balances or your balance thing. All right, and those are some of the key facts of Chapter 31. Some key terms definitely need to know. BUN, okay, blood, urea, nitrogen. Some of them I already said. Hematuria, renal calculi, specific gravity, urinary tract infection, urinary retention, and how much is the gold standard of urine output per hour? Remember, 30. So if your patient has less than 30 milliliters per hour, you better be notifying the doctor. We're asking the patient if they have the void, taking your next to a bladder scan. You need to do your interventions as a nurse based on your facility protocol. All right, and that's Chapter 31.